Motion sickness. Causes and prevention tips. Welcome back to HGH Health Hub. Recover and thrive. Your trusted source for health and wellness insights. Today, we're diving into the topic of motion sickness, a common condition that can turn an enjoyable trip into an uncomfortable experience. We'll explore its causes, symptoms, and top tips for prevention. Don't forget to like, subscribe, and hit the notification bell for more valuable content. Let's get started. What is motion sickness? Motion sickness is a condition that occurs when there's a mismatch between the signals your brain receives from your inner ear, eyes, and sensory nerves. This disconnect confuses your brain, leading to symptoms such as nausea, dizziness, and sweating. It commonly occurs during car rides, boat trips, flights, or even amusement park rides. Quick fact: motion sickness can affect anyone, but it's more common in children, pregnant individuals, and people prone to migraines. Symptoms of motion sickness. The symptoms of motion sickness can range from mild to severe and may include nausea and vomiting, dizziness or lightheadedness, cold sweats, increased salivation, fatigue, loss of appetite. Symptoms usually subside once the motion stops, but for some, they can linger for hours. Causes of motion sickness. Motion sickness occurs due to sensory conflict. For example, when you're reading a book in a moving car, your eyes see a stationary object, the book, but your inner ear senses motion. On a boat, your inner ear detects motion, but your eyes might see a stable horizon. Host. This conflict confuses your brain, triggering the unpleasant symptoms of motion sickness. Prevention tips for motion sickness. The good news is that motion sickness can often be prevented or minimized. Here are some tips. Choose the right seat. Sit in the front seat of a car, near the wing of an airplane, or in the middle of a boat where motion is less pronounced. Focus on the horizon. Keep your eyes on a stable object in the distance to help your brain process consistent signals. Avoid heavy meals. Eat light and avoid greasy or spicy foods before traveling. Stay hydrated. Sip water or ginger tea, which can help soothe your stomach. Take breaks. If possible, stop and get fresh air during long trips. Use acupressure bands. These wristbands apply pressure to a point on your wrist that may help reduce nausea. Try medications. Over-the-counter medications like dimenhydrinate, Dramamine, or prescription patches can be effective. Tips for managing motion sickness when it happens. If you start feeling symptoms, here's what you can do. Stop the motion. If possible, take a break from the activity causing the motion. Fresh air. Open a window or step outside to breathe in fresh air. Lie down. Resting with your eyes closed can help reduce symptoms. Stay cool. Use a cool cloth on your forehead to ease discomfort. When to see a doctor. For most people, motion sickness is a temporary nuisance. However, see a doctor if you experience motion sickness frequently and severely. Symptoms persist even when you're not in motion. You have underlying conditions that might be contributing to the symptoms. Motion sickness doesn't have to ruin your travel plans. With the right strategies, you can enjoy your journey comfortably. If this video helped you, give it a thumbs up and share it with your travel buddies. Don't forget to subscribe to HGH Health Hub. Recover and thrive for more health and wellness tips. Thanks for watching, and safe travels.